Welcome back guys. In this video we are going to discuss renal stones with tricks and mnemonics. So we have four major types of renal stones: calcium oxalate, triple phosphate, cystine and uric acid stones. So let's start with the most common type of renal stones, that is calcium oxalate stones. So these stones are radio opaque, meaning they can be visualized on X-rays. So quick fact, all the major stones are radio opaque except uric acid stones, which are radiolucent. So the precipitating factors for calcium oxalate stones are acidic urine and hypocitrate urea. We have two types of calcium oxalate stones, monohydrate and calcium oxalate dihydrate. The calcium oxalate monohydrate stones are dumbbell shaped and they are very hard. Whereas the dihydrate, they are envelope shaped and they present very early with pain and hematuria. So here's the trick. If a guy is single, that is mono, he is at the gym lifting dumbbells. So these monohydrate stones are dumbbell shaped and they're very hard because the stones are hitting the gym. Whereas if he's in a relationship, that is there are two people, right? These people will be sending love letters in envelopes. And if that relationship breaks, it's going to hurt a lot, just like dihydrate stones, which present early with pain and hematuria. So calcium oxalate monohydrate, dumbbell shaped and they're very hard, whereas the dihydrate ones, they're envelope shaped, love letters in envelope, and they present early with pain and hematuria. Now let's discuss triple phosphate or struvite or staghorn calculi. So these are also called as staghorn calculi because of their growth into huge branching stones. Here we have calcium, ammonium and magnesium phosphate. Now for the trick. Imagine a Formula 1 car, but it's not Ferrari or Mercedes. Instead, it's an MG car. So that will help us with a mnemonic. We are in the audience cheering for this MG car. How will we cheer? We'll be like, come on MG, come on MG. So Ca for calcium, mon for ammonium and Mg for magnesium phosphate. You know, the Formula 1 drivers will be having intense training sessions, right? And they'll drink, they won't drink normal water like us. They'll drink some alkaline water. They'll take a lot of protein. So alkaline water will help us remember alkaline urine, and protein will help us remember urease positive bugs like Proteus infection, which are precipitating factors for these triple phosphate stones. And again, Formula 1 is a deadly sport. A small mishap will make the driver end in coffin, which denotes coffin lid shaped stones, which is the appearance of these triple phosphate stones. Next we have cystine stones, which are the hardest stones. Remember it with cysts that we study in microbiology, which are very hard and they're also resistant to many disinfectants. So just like the cysts which are resistant to disinfectants, here cystine stones, which are the hardest stones, are also resistant to extracorporeal shockwave lithotripsy. And these appear hexagonal in shape. To remember this, you can also write cystine as 16. It sounds similar, right? So this 6 here will denote the hexagonal shape, that meaning 6 sides. These are precipitated in acidic urine. Also a quick fact, all the major stones, almost all of them are seen in acidic urine, the only exception being triple phosphate. Like I said, alkaline water, sports people. So alkaline urine precipitates triple phosphate stones, whereas all the others are precipitated in acidic urine. And these are seen in cystinuria, which is a genetic defect in amino acid reabsorption and managed using D-penicillamine. Coming to the last of the major 4 stones, we have uric acid stones. And the special thing about this is they are radiolucent. To remember this, note the letters R and I in the word uric, right? So R here stands for radio and I, which looks like the small letter L, denotes lucent. These look like glass shreds or rhomboid in shape, and as the name suggests, acid, they're also seen in acidic urine and in conditions like tumor lysis syndrome and gout. Finally, there are also some rare stones worth knowing. We have xanthine stones, triampterine stones, and indinavir stones. All of them are radiolucent. So to quickly recap, we have calcium oxalate stones, which are the most common. They can be either dumbbell shaped or envelope shaped. Then stroide stones, staghorn calculi, and coffin lid shaped, precipitated in alkaline urine and proteus infection. And cystine stones, which are the hardest stones, which are hexagonal in shape and resistant to ESWL. Lastly, uric acid stones, which are radiolucent, seen in tumor lysis syndrome and gout. If this video helped you, make sure to like, share, and subscribe for more such high yield mnemonics. Thank you.